Good afternoon, everyone. Family cheers, there's my sister. My name is Dr. Brad Robinson. I'm one of the obstetricians and gynaecologists from Greenslopes Obstetrics and Gynaecology. We're Brisbane's newest group obstetric practice, and we're proud to say we're the most comprehensive service now available in Brisbane, out of the best facilities with a maternity service that's absolutely second to none. The facilities really are amazing. It's like a five-star hotel, so it makes my job very easy. So today I wanted to talk to you about, you've all heard of that famous book, right? What to Expect When You're Expecting? Okay, well this is the summarised real-world version of that book. So this is what to really expect when you're expecting. So we're going to cover briefly what to expect before you're pregnant, during your pregnancy, during your labour, or does anyone not want to talk about that? And then after delivery. So let's start with preconception, as we call it in the medical world. Could anyone guess here what the conception rate would be for a couple that had tried to achieve pregnancy over a 12-month period? What would their chance out of 100 of falling pregnant within that time frame be? Anyone want to hazard a guess? Would it be 50% or 90%? Very close. What was that? How much? 5%. No, closer to 90. It's 85%. So the average couple that have attempted to fall pregnant over a 12-month period, 85% of them will achieve that. So the breakdown for that typically is if you're wanting to fall pregnant, you've got about a 15% chance per month of achieving that, and we call that fecundability. Stupid word. We think that we sound clever when we use these words. So your fecundability is about 15% a month. So that amount does drop, however. So it's 15% averaged, but in your first month of trying to achieve conception, your success rate is probably going to be more of the order of 25%. And then as the months pass, and if you haven't achieved pregnancy, your success rate will decline. So then we get into the area of, do you have a fertility issue or not? If you haven't achieved pregnancy after 12 months of trying, and you're under the age of 35, that's an appropriate time for you to get referred to someone like myself to look into whether or not there's a fertility issue. If you're over 35, because the months and years are quite precious, if you've attempted pregnancy for more than 6 months and you haven't achieved it, that's when you'd come and see someone like myself. So, if you're attempting to fall pregnant, can anyone think of the sort of things that you should do immediately? I don't have any gold stars to hand out, I'm sorry. Get off the pill, yes. Have sex, thank you, yes. You can't tell that she didn't go to high school, can you? Lose weight, thank you. A sensible one, good, excellent. So you want to lose weight? Exercise, absolutely. So we know that fertility is very strongly tied up with body mass index. So if you can achieve a healthier weight as possible, you're going to improve your chances. So you want to try and get your body mass index down to preferably the perfect level of 20 to 25. If your BMI is above 35, we actually recommend not attempting conception. So you want to lower your BMI, you want to exercise, you want to eat well, and you want to stop smoking. Smokers, raise your hand. Out and proud. There's only one admitting it. There's guaranteed to be more. You're on it. That's right. Okay, so if you're attempting to fall pregnant, you'd want to stop smoking as well. Can anyone think of a medication that you should take if you're trying to achieve pregnancy? Vitamins, yeah. Pregnancy vitamins are excellent. Anyone in particular? Folate, absolutely. So you want to take folate, preferably for up to 3 months before you conceive. What's that, mate? I'm old and deaf. Yeah, Blackmores are one of the companies that do the pregnancy multivitamins, and they're a good brand. So you want to take folate. Folate reduces the incidence of your baby having a spinal cord problem during its developmental phase. You also need to see your doctor, preferably, to get your antenatal blood testing done. So get all your antenatal bloods done so you can find out if there's an issue that you need to address. What's your rubella status, German measles? Are you immune to it or not? Are you anemic? Do you have an infection that needs to be treated? So all those things should be sorted out from the get-go if possible. You also want to think about possibly getting vaccinations. So the influenza vaccination is actually recommended by Australia's peak medical body to be done during pregnancy, if not before. Whooping cough, I wouldn't recommend it, but if you ever Google whooping cough or look at it on YouTube, seeing babies with it, it's quite terrifying. So it's always a good idea to get a whooping cough vaccination prior to achieving pregnancy, or even in the third trimester of pregnancy. Now, so we're still in the preconception stage, so let's talk now before we move to pregnancy about timing of intercourse. So the humans are quite amazing in the fact that we have this, what's called medically a fixed luteal period. So that means we can predict when ladies are going to ovulate. So when their egg is released and it's available to be fertilized by a sperm. Now that happens almost without failure 14 days before a lady's period. So if you've got a 28-day cycle, that means you're going to ovulate on day 14. Now the egg only lives for about 12 hours. So if your gynecological tract is not pre-populated with daddy's swimmers already, the egg's going to die before it fertilizes. So you want to be having intercourse before that ovulation date. So it's 14 days before. So if you have a 32-day cycle, then it's going to be day 18. Does that make sense? Okay. Now, let's assume we're pregnant. We're in the first trimester of pregnancy. So the first trimester goes up to roughly, say, 13 weeks. Can anyone think of, what's the first thing you think of when you think of the first trimester of pregnancy? Vomiting, exactly, morning sickness. So morning sickness will affect something of the order of 90% of ladies. Has anyone here had morning sickness? Yeah, nasty? Yeah, not cool. So morning sickness, the peak times for it are somewhere between 9 weeks and 12 weeks. It doesn't always, however, read our textbooks, and it quite often affects ladies earlier and much later. It can be difficult to treat, so it's one of those situations where the woman herself and the couple actually probably do more about treating it than we do. It's important to try and recognise your triggers and avoid them. So are they spicy foods? Are they citrusy foods? Is it smells? Is it something that you might drink? So avoiding the triggers and then getting into medication if you require it. First trimester is also the time when you should have done what's called combined first trimester screening. Have you guys heard of Nuchal scans? Yep. Has everyone had anyone that's had a baby? Has anyone here that's not had a Nuchal scan during their pregnancy? Good. Okay, so in Australia we have a system whereby we screen ladies to see if their pregnancy is at high risk for having one of the three major chromosomal abnormalities of pregnancy. So chromosome 21, trisomy 21, which is Down syndrome, or chromosome 18 and 13. So we do blood tests for the women and a scan for the baby, and then we combine all that into a mathematical formula, and it gives us a risk factor for whether or not the baby is at high risk or not of having one of these chromosomal abnormalities. Now, this testing has to be done at specific times. It has to be done between 11 weeks, roughly, and 13 weeks and 6 days. So it's important that you go and see your doctor, get referred off so you can figure out how many weeks pregnant you are and then get this testing done. If that testing suggests that you're high risk for one of those abnormalities, you can, if you want, then elect to have invasive testing, which is an amniocentesis. Did I see anyone flinch then? Or a chorionic villus sampling. Okay, so you've moved beyond 13 weeks. Your morning sickness is now healed thanks to the brilliant advice of your obstetrician. And you're in the second trimester. The second trimester, I tell my patients, is typically the best trimester because you're through all that difficulty. The pregnancy has made it through the first trimester. Typically, you're feeling better. And you're not into the final trimester where you're feeling all that discomfort and anxiety. So the second trimester is usually the good trimester. So not a great deal happens during that trimester, but one of the first things I notice people do is that's when they tell people they're pregnant. So a lot of people hold off till they're 12, 13 weeks. Did anyone here tell their family and friends earlier than that? Yeah? Anyone tell them much later than 13 weeks? No, usually it's by then. Now, one of the reasons for people holding off until about 13 weeks to tell their loved ones that they're pregnant is a fear of miscarriage. Thankfully, now that we've got the ability to do detailed ultrasound scans, we can scan and find a heartbeat if there's one present as early as 6 to 7 weeks on an abdominal scan. we know that once we've done that, your chance of carrying that pregnancy to term and taking it home with you is greater than 93%. So I think in future we'll find that ladies are typically telling their loved ones earlier when they are pregnant because they've got less chance of miscarriage. So the big ticket item in second trimester is a morphology ultrasound scan. So a morphology scan is when the scanning agencies do a detailed scan from tip to toe, so top of the head to tip of the toe, and they look at everything. Does the baby have all its bits? Are they all in the right spot? Are they all roughly the right size? Of those bits, obviously, one thing that most people are interested in are, what are they having? Are they having a boy or a girl? Most people find out. Does anyone here not find out what they had? Yeah? You're one of few. Most people do, don't they? So no one else? No one else decided not to find out? Okay. There are increasing reports of health agencies around Australia refusing now to tell people, even if it's obvious what they're having, because of fear of litigation. So that's quite disappointing, really. Second trimester of pregnancy is also one of my favourite things about pregnancy, is this phenomenon called PICA, P-I-K-A. Has anyone heard of PICA? Random word. It means craving to eat non-food items. Like dirt. Have you heard of pregnant ladies wanting to eat dirt? Has anyone here had any PICA? Any craving of non-food items? Your grandma ate chalk with mustard. That's a beauty. I haven't heard of chalk before. My wife, who's not here anymore, she once met a lady through Meals on Wheels, this lovely old duck called Shirley, and Shirley confessed that she had PICA for the tops of the old wooden pegs. She used to eat them, and also, quite disturbingly, for petrol. Her GP said to her, I'll let you have 1 teaspoon a week. So she used to have a teaspoon of petrol a week. I wouldn't recommend it. Okay, so we've moved beyond second trimester. Everything's going swimmingly. We've entered third trimester. Third trimester can be the one that is more difficult. The joy and the excitement of being pregnancy has typically worn down a little bit. The discomfort has gone up a little bit. Also, the thoughts about labour, how's this damn thing going to come out of me, are starting to get in the mind. And that can be a real concern for some people, obviously. So it's a tough trimester. It can be anyway. So the frequency of your visits to your obstetrician will increase. So you'll see your obstetrician from 28 weeks up to 36 weeks every 2 weeks, and then from 36 weeks to delivery approximately weekly. During that time, you want to think about 2 things. The mode of delivery, so is this going to be a vaginal delivery or will it be a caesarean section? And secondly, the timing of delivery. Is it appropriate to wait until you go into labour? Or is there a reason that you may need to be delivered earlier than that or induced for some reason? Now, there can be a million reasons to go either way for both of those approaches, so there's something that are typically worked out very specifically with your obstetrician. Generally speaking, if everything's going well, it's a spontaneous labour and it's aimed for vaginal delivery. But again, there are other reasons why people may not have that occur. Testing-wise, during the third trimester, you'd get bloods done at 36 weeks to check for anemia and your blood group and antibodies. And you'd also, at least through our practice, we screen for a little bug called GBS, Group B Streptococcus. Not all practices do that, but we do. So GBS, if it's present in mum's reproductive system, it's very common. It's carried by about 20 to 40% of all ladies, naturally occurring bug. Then we give you antibiotics during labour. Then we've got into delivery. Anyone got any anecdotes or stories I'd like to share about their deliveries? No, most people have the same response whenever I ask that question. A lot of people... some people don't tend to like to revisit that time, especially the older mums amongst us. But now, thankfully, there are more options for mothers in labour and pregnancy that arguably were not available in the past. So one of the things that you want to talk to your obstetrician about during the late stage of your pregnancy is analgesia in labour. So firstly, would you like to have any pain relief available to you? And if you would, what sort? Or would you like to would you like to do it naturally without pain relief? There is a bit of a trend for some people to strive to achieve a non-pain relief delivery, and that's fine, each to their own. But I would say if you want it, then don't be shy about asking for it. And at Greenslopes, we have a 24-hour-a-day anaesthetic cover. So if you go into labour at 2 a.m. in the morning, you want an epidural, some hospitals I've worked at, you can spend 4 hours trying to get an anaesthetist to come and put an epidural in, and they typically refuse to get out of bed. But thankfully at our facility, we have it guaranteed. So if you want an epidural, you can have it. Okay, so let's assume your delivery's gone well. You're going to stay in hospital at Greenslopes if you deliver there for 4 days, if you have a vaginal delivery, or 5 nights if you have a caesarean section, and then you go home. And quite often women feel like when they've gone home, they've been abandoned. They've got no care, they've got no support. There's no instruction manual that comes out after the placenta, so they don't really know how to cope with this baby. So we offer a facility whereby a midwife will visit you at home at our expense, not yours, and they give you assistance with breastfeeding, bottle feeding, nursing, wrapping, settling, whatever you would like. During that time, it's also important that the mother and the couple have a plan for things like contraception. Especially if the mum's had a caesarean section, it's typically not a great idea to fall pregnant straight away while they're healing. So contraception is something that we like to line up prior to the mother being discharged from hospital. So the standard contraceptive pill can interfere with breastfeeding, so there are a range of other options, including Mirenas or mini pills, or just a whacking great big lock for the bedroom door for mum. Another thing to be aware of after delivery is postnatal depression. Postnatal depression is an area that I'm quite interested in, and it's frighteningly common. It must feel like if you've had it, you're the only person in the world that suffered from it, because it is quite I'm told, quite an isolating feeling. But it's very common, and we've now got very good strategies for identifying it and dealing with it once it occurs. Now, to end on that positive note, does anyone have any questions for me about anything pregnancy related? So the question was, with postnatal depression, do people go onto medication? Medication certainly can be one of the avenues of treatment, and it can be very effective. So that is certainly one of the options that we look at, typically in conjunction with other treatment modalities as well, such as counselling, family supports, social work assistance to relieve the burden that some mothers do feel when they're pregnant, especially if they have, a husband that works long hours, no family, a small friends network in the town they may have just moved to. So it's certainly one of the options, yeah. That's it's very difficult to answer. They've done autopsies on any number of people that have been confirmed to have depression, and they haven't to this point isolated a so-called a specific deficiency, but there certainly is an improper function in the way that the neurotransmitters in the brain work. Yeah. Any other questions? Yes. Good question. How to choose your hospital and obstetrician. I should have mentioned that in the first trimester when you fall pregnant, so typically most people find out through a wee test. And those wee tests now can pick up the hormone beta-HCG from 8 days after conception, which is terribly early. So you can actually be still within the parameters of your normal menstrual cycle and not have to bleed and find out you're pregnant. So one of the things you need to do is figure out, do I want to deliver publicly or do I want to deliver privately? If you want to deliver privately, who should I use? So, look, publicly, Australia is lucky that we've got awesome public facilities. You're guaranteed to be looked after. The healthcare facilities in Australia in terms of maternity units are fantastic. I guess if there is a downside, it's that you don't have that direct, specific one-on-one care with an obstetrician. But again, each to their own. And privately, certainly the downside is the expense of it. So you do really require private health coverage to pay for the hospital's bills. And then the obstetricians and the anaesthetist typically charge an amount as well. So you've got to weigh that all up and then decide, if you're going privately, how do I choose who I want to use? It used to be in the old days that you'd go to your GP and the GP would say, oh, I send all my patients to Dr. Jones. I'm referring you to Dr. Jones now, whether you like it or not. But now there's been a real shift in the way that works. And with the advent of social media, the internet, thankfully now ladies and couples have more of a choice. They can have more of a direct say on who they want to use. So we now find more so that people go to their GP with an idea already. I want you to refer me to Dr. Smith. And you might have had a look on the website to see what they're like and get a feel for them. So I'd say to you, if you're not sure about who to use, utilise the sort of tools that you have now, like social media. So a lot of people, like for instance, I have my own doctor's Facebook page, Twitter account, which is just killing me. I'm too old for this stuff. Web page. So you can go to those things and get a feel for that person. Are they the sort of person I'd like to use? Do they have the same sort of values as me? And then you can Google it and find chat forums and ladies complaining or praising their obstetrician. Yeah. Any other questions? Yes. So the question is, how early do you need to book in if you're going privately? It commonly used to be that people would book in after, say, 12 or 13 weeks, again for the reason of the perceived increased risk of miscarriage. But now, I guess I see most of my patients anywhere from sort of 7 weeks onwards. So not uncommonly, as soon as people find out they're pregnant, they'll see their GP and get referred across. And also they'll do that without having had any scans or bloods done initially. So really, we don't mind. We're happy to take a referral whenever you would like to be seen, particularly if you've got concerns about something. If you've had a previous miscarriage or you've had a medical condition that you need to have optimised early in pregnancy, we're happy whenever. Yeah. Any other questions? No? Okay. Thank you for taking the time to listen to me today.